Hi, everyone. I'm Dr. John White, the Chief Medical Officer of WebMD and host of Your Health on Tech. Ever wonder how temperature impacts your health? You might be thinking you like it cold, but others like it hot. But I'm thinking saunas. Can using a sauna, yes, I said sauna, improve your health? Well, a recent study suggests that spending 20 minutes in a sauna several days a week can give you as much benefit to your heart as working out. Hard to believe. So, helping me to help you figure it all out is Dr. Christopher Minson. He's a professor of human physiology at the University of Oregon. Dr. Minson, thanks for joining me.
Thank you very much. Honored to be here.
You're an expert in thermogenesis, things about heat. So I have to ask you, as we're all talking about trying to lose weight and get healthy, are we wasting our time at the gym by going to the weight room or the cardio when we should just be going to the sauna?
Yeah, great question, and certainly a question I get a lot. I think there's a lot of people out there who really do not like exercise. But I will say, as an exercise physiologist primarily, it's where a lot of my training has been, I would never say do not exercise. There are so many benefits to exercise that I would never recommend someone not doing it. And certainly, as you mentioned, doing cardio and strength training both is critically important. One of the things that I think is really important is that we still don't understand a lot of the benefits of exercise. How just going to a gym and working out, how does that make us better, stronger, healthier? And part of that is the rise in body temperature. It's almost impossible to exercise without having a rise in body temperature. So the real investigations in my lab have focused on how can we use the rise in body temperature through different means to drive physiological changes that we know are associated with improved cardiovascular and metabolic health.
But the sauna itself, because of these high temperatures, are they inducing the same type of physiologic response as exercise? Help explain to our audience why we're starting to see some of these study results that suggest the use of saunas.
Yeah, again, really excellent question. One that I get a lot because there's a lot of confusion out there how that can be. If we think about any kind of stress, so we can use heat stress, we can talk cold stress or hypoxia, or exercise stress. These are all stresses to our system. So if you do it once, after you do it, you're technically weaker and more broken down than you did it before. But then if you do it repeatedly, then we have an adaptation. This assumes we have time between the first stressor and the second stressor, and then you have time to adapt, and you keep doing that over time, over time. Well, that adaptation that we have makes us healthier, makes us stronger, makes us better. Heat stress specifically, we know that there's an increase in heart rate. You can feel it. Your heart is beating harder, it's beating faster. You have changes in the distribution of your blood flow throughout your body.
Mhm.
You've got the way your blood flows through your blood vessels is in a more healthy fashion than it would be similar to what we see during exercise. And central to this question, we also have these aptly named, for this case, heat shock proteins. And these are little proteins that are in our body, in every single cell of our body. They're highly conserved, meaning they've been part of us since we first were crawling out of the oceans, even before then. And they really are important for us to respond to stresses like heat, for instance, and make our cells function better.
But why is the heat in the sauna different? Because just using your argument, I could say, well, people that live in warm climates or people that don't use air conditioning on hot summer days, they're getting a benefit from that. But we know that's not true. So, what's different about a sauna?
Yeah, so if we use sauna and we use hot water immersion as well, which is basically sitting in a jacuzzi or a hot tub. There's other ways to get heat stressed as well. But the short answer to your question is that it's the stress, recovery, adaptation,
Mhm.
stress, recovery, adaptation phases that allow us to be healthier. The same idea as if you say, well, we know exercise is healthy. Well, as I mentioned at the start of this, if you exercise, you're actually broken down afterwards. So if I said, well, just go exercise all the time, exercise all day long, we know that's not healthy. right? If you don't allow for that recovery to occur and that adaptation to occur. So it's the stress. We have, inflammatory stresses, we have oxidative stresses that occur with exercise, that occur with sauna use, and then we recover from that, and that allows it to be healthy.
But on some of these studies relating to saunas, and let's be fair, many of them were done in countries such as Finland, where there is a greater cultural aspect of using a sauna. There's a dose dependent response as well, isn't there? So help explain what we're seeing there and in the use of sauna specifically.
Right. And you hit the nail on the head at the very start where you said, some of these early studies shown that, if you go 1 day per week, that's better than not going at all. And that's the challenge with the Finland studies is that that was the minimum dose they had was 1 day per week because it's part of their culture. For our studies, we get people who are naive to any kind of heat stress. And we have one group that doesn't get any more heat stress, and we have
Mhm.
some who get a fairly good dose of it. We are right now with heat therapy, as we're calling it, really in the early days, kind of like we were with exercise training in the 40s and 50s, right? We're trying to find the best frequency, intensity, time, and type to really understand where the benefits are. People always want to know what's a minimal effective dose. And we don't have the answer yet, but definitely 1 day per week is showing some benefits in some studies on both mental as well as physiological changes. We know that more is better, but we also know that like exercise, too much is too much.
So, what is too much when it comes to the sauna? Because you see signs that say, don't spend too long in there. We know that some of these temperatures can be as high as 200 degrees. Now, we would never do that in a normal environment. So, what's that right dose that's
Right.
safe for most people?
Yeah, great question. Our general way of thinking about it is if someone is approved to start an exercise training program, they can absolutely start a heat therapy program. So that becomes where do you start? Like exercise, you want to start low, right? You want to start easy. So I have a sauna in my house and I read the brochure and all that kind of
Mhm.
stuff. We keep it a little bit lower temperature. So it seems really, really hot, but it's a dry sauna. So it's probably start around 160 degrees into 10 minutes. So start at a lower temperatures and start to see how you feel comfortable. And we have this pretty famous scale called the Minton scale, which, okay,
Mhm.
not famous, but maybe someday. And it's a very simple scale because I'm a simple man. And that is, it goes from 0 to 10. 0 is I'm perfectly thermoneutral. I'm not hot. I'm not cold. I'm just the absolute perfect temperature. And 10 is I'm the hottest I've ever been in my entire life. I'm really miserable. We want people in the sauna or hot tub in about a 6 or a 7. So if you're getting to a higher 7 or 8, where you're saying, I'm getting kind of uncomfortably hot, it's time to step out, right?
Right.
Once you become more practiced, then you can push the boundaries a little bit. But if you're getting where you're uncomfortably hot or
Mhm.
miserably hot, you need to step out. And how we feel is a very good guide for that. If anyone says, well, I'm hot, but I'm uncomfortable versus I'm uncomfortably hot, well, uncomfortably hot is too hot,
Right.
right? But with time, we adapt and we can adapt. Humans have an incredible ability to adapt to heat. That's why 200 degrees, and if it's dry, you can sit in there easily for 30, 40 minutes if you're adapted to that environment.
Now, let's spend a minute talking about infrared saunas because we're seeing more about that in the news. They heat at lower temperature. Is that right? Explain the difference.
Sure. So, as we mentioned before, a traditional sauna uses a dry heat, some kind of heating element that gets very hot, makes the room usually between 160 to 200 degrees, in a very low humidity in that case. And from that case, you can think of our body as heating from the outside in, right? Our environment is very, very hot. A far infrared sauna uses infrared lights, and that infrared light penetrates through our muscles. And so we're heating almost from the inside out. So most of these, the commercial ones, will probably stop heating at about 140 or 150. I've seen some as high as 160, but I think 140 to 150 degrees Fahrenheit is kind of the limits. So what happens is when it gets that temperature, it actually cycles off because it doesn't want to keep adding heat to yourself and to the environment. So what's important on those is that you want to get in when it's about 100, 110 degrees and be in the far infrared sauna while it's heating up, because that's when the infrared lights are on. And that's when you are gaining the heat.
And what about the steam room? A lot of people like that eucalyptus smell. Why aren't we getting benefit from the steam room?
Yeah, you definitely do. You definitely get some benefit from steam room. The difference with steam room is that's a very, very humid environment. And
Okay.
so not only is your body temperature high, your core body temperature, but your skin temperature is very high. And that makes you feel much, much hotter.
Do we see benefits of cold temperature? You've been talking about the benefits of hot temperature. It raises our heart rate, it changes in terms of how our blood supply distribution goes. What about on the flip side? Cold.
Yeah. Again, a great question, and one that there's a lot of interest right now with people like Wim Hof, who's been a kind of the Iceman and really pushing the cold therapies. The long and short answer is that there's not enough research yet on cold stress to show a whole lot of benefit in the way I'm talking about. There are some limited studies showing that when you get cold stress, especially for about 15 minutes, there are, your heart has to work harder, your blood flow through your blood vessels changes, similar to like I mentioned during heat stress. So there are some potential benefits from there. It seems a lot of the benefits from the cold stress are through two other mechanisms. One is we increase our brown fat, which is a kind of more healthy, metabolically active fat, and we get some beiging of or darkening of our white fat cells as well, and that makes them a little bit more metabolically active. You come out afterwards, and you feel elated, you feel good, and for a period of time, right? And so I think that mental health benefit really drives a lot of the physiological health benefits associated with cold and to heat as well.
So, Dr. Minson, what's your message to viewers? Because there are some cautions, as you pointed out, these higher temperatures are not for everyone, but how should they consider the role of saunas when they're thinking about their overall health?
I want to emphasize again, exercise is incredibly healthy for you.
Mm.
Um, but we're seeing more and more studies interested in looking at how we can add to that benefit or prolong some of that benefit from exercise by adding heat stress afterwards. So it is a classic: go to the gym or go work out and then take a hot bath or take a hot sauna afterwards, and you can actually extend some of the benefits from exercise or expand on that. There are certain populations of people who just absolutely will not exercise. There are people who don't get the full benefits of exercise. For instance, people with spinal cord injury, paraplegics, for instance, who can only do upper arm exercise, or tetraplegics. We have studies now looking at those populations, and we've seen that those individuals can get real benefit from heat therapy, and that goes way beyond the benefits of exercise. So to answer your question, the goal for me always is to people do it safely and incrementally. Then with that, the big thing is making sure you hydrate, right? So you're sweating a lot. And so it's a great way to do it is take your body weight before you get in the sauna and after you get in the sauna, and see what the body weight change, taking into consideration any water you're drinking, and hopefully you're not urinating during that time. But then you can get a good idea of how much fluid you have to rehydrate.
Mm. And to your point, it's also based on your underlying health conditions. Just as you want to be clear to exercise, you want to be able to be cleared to be able to spend time in the sauna based on any health issues you might have. Dr. Minson, I want to thank you for taking the time today to help explain the role of temperature and particularly saunas as it relates to our health.
Well, thank you so much. It's really a pleasure for me, and I love the fact that you're helping push this the heat therapy as a potential health benefit.